So you're wondering what to expect when you're going to be getting dentures put in your mouth? Don't worry, you've come to the right place. Dale Reynolds here with a different kind of video for you guys today. I am going to do this because I've had a couple requests for it. Genuinely want to help some people out on this topic is what to expect when you're getting dentures. Hopefully help ease your mind a little bit, because I understand I myself felt the same way. I was nervous and anxious and I was scared, nervous, and all that. It is a common feeling, trust me. It's a very common feeling of avoiding the dentist and having dental work done and all this other stuff. What I want to do is take you through my experience and help you out, because I can tell you right off the bat, number one, your fears, your anxiety, you're gonna overshoot it by a grand mile. You have nothing to worry about. So the first things first, I'm gonna assume you've already had your consultation appointment, where at this point the doctors have already looked at your mouth, they've run through the options with you, and you have decided, you know what, dentures is gonna be the best way to go. What's gonna happen at this point? At this point, they're going to have an appointment for you before you come in for your surgery. What's going to happen is that they're going to take the impressions of your mouth, and they're going to give you a cage, and it's a metal cage looking thing. It's going to feel like it does not belong in your mouth whatsoever. It's going to feel like it's way too damn big. What they're doing with this cage is they're going to fill it with this resin, I guess. I don't know if it's a resin or whatever the case may be. But what they're going to do, they're going to fill it with this resin that's soft. And what they're going to do is they're going to take the whole thing, they're going to stick it in your mouth, they're going to press down. What they're doing is they're taking the impression of your mouth, how your bite is, how everything is of your mouth at this point with the teeth still in your mouth. They're doing this because they're going to give you temporaries. As soon as you have your extractions done, you're going to leave. After you have your surgery and your extractions done, you're going to leave with teeth in your mouth. There is no concern with getting the impressions done. The only thing that is even a relative concern is that it's going to be cold. It's going to be cold. And if you have sensitive teeth, or even like me, where my back teeth were broken and exposed, that they're going to put that stuff in your mouth, and they're going to put it down on your teeth. And they're going to hold it. And you got to hold it for like 3 or 5 minutes or something like that. It's not going to hurt a whole lot. Trust me, I'm a sissy when it comes to pain. But it's going to get your attention. It'll definitely get your attention. It's going to be one of those things where it's like, ooh, yeah, that doesn't feel very good. But what it does is it'll warm up and you'll get used to it. And what's going to happen is this resin is going to harden. It's going to harden to the point where you're going to sit there and start thinking, man, if they pull this out of my mouth, it's going to pull all of my teeth with it. Like, that's not going to be good. Trust me, your teeth are not going to come out of your mouth. It doesn't taste very good either, honestly. That is what to expect on that next appointment, to do the impressions of your mouth. That doesn't take very long. It'll take only about 15 minutes. So after the impressions and leading up to your surgery, you are going to be nervous. I know this. I was nervous myself, but let me tell you, like I said, you're going to overshoot your worries by a grand mile. You're going to be worried about, well, what if this happens? What if this happens? What if this happens? My God, the night before, you're not going to sleep, and relax. It's not going to be that bad, trust me. Now, whether you have decided that you're just going to get the novocaine shots in the mouth and stay awake, or if you're going to get knocked out, whether it be by they give you a needle or they give you a gas mask. I went with getting knocked out. I had been knocked out before. I had open heart surgery when I was a kid. I know what it's like to get knocked out, so it is familiar territory. Going into surgery, and that's what I call it, it's surgery because it is major oral surgery. They're going to go in, and the surgery itself is not going to take long depending on how many teeth. I mean, if they're going to pull all your teeth, even that is still not going to take very long. I had 26 teeth pulled. I had my entire top deck pulled, and I have 5 on the bottom. 3 right here, and 4 and 5. I was in and out in 2.5 hours, maybe even less than that, probably closer to 2 hours. But I was in and out very quickly in the same day. They did all 26 right then and there. Done deal. And what happens is that you have your surgery. If you were put out, what they're going to do is they're going to wake you up. They're going to put you out in the regular dentist office instead of the surgeon's chair. and they're gonna just make you sit there for 20-30 minutes. To me, I was still whacked out on whatever they had for me. It felt like it was 5 minutes, but I sat in that chair for 20-30 minutes, and they just kind of let you sit there, and you kind of get out of it. At this point, after surgery, it could be either before you wake up, after you wake up, whatever the case is, but regardless, before you walk out of that door, the dentist is gonna put your temporary dentures in. It is super important, super important that you keep those in your mouth. Now from this point, the best thing for you to do is to just go home and rest. As much as it might sound boring, it might sound fun, different strokes for different folks, right? But sit and relax. And the doctor is going to prescribe you an anti-inflammatory, which is also antibiotics. They're going to prescribe you pain pills. Let me tell you something. They prescribed me pain pills. I didn't need them. Pain? I didn't have any pain. I didn't have any pain whatsoever. I wouldn't even call it pain. It was discomfort. Was after the surgery, and it was discomfort because I was still getting used to dentures. But just a word of caution on the antibiotics. Those antibiotics probably did more in making me feel weirded out than anything else that they would have given me, because the antibiotics, to me, and I know everybody is different, I have a low tolerance for anything foreign inside my body. I have a low tolerance. I am a cheap drunk, and yeah, I would recommend not going to work. Not going to work for at least a week until the antibiotics are done. The antibiotics obviously will help reduce the chance of infections and reduce the swelling and all that other stuff, but when I took those antibiotics, I would just be sitting there in front of the TV. I'd be watching How I Met Your Mother, like, yeah, that's just is what it is. Some people have a different reaction to different things, and I would just, those antibiotics, just a word of caution, I'm just putting it out there that it could be, those antibiotics could really mess with your head. You're going to go home, you're going to relax. I would relax for at least the 3 days, because they're going to tell you for at least 3 days, don't do any strenuous activity, don't smoke. If you're a smoker, don't smoke, don't drink. Obviously, you still got open sockets. This is the biggest thing for healing, is to make sure that you do it right within the first couple of days. Don't immediately jump the gun and think you can start eating stuff. That's not going to happen. It's not going to happen. Your gums are going to be so swollen and so sensitive that you're barely going to even be able to just clamp down like this. Your mouth is going to be getting used to everything. You're going to be drooling a lot. You're going to be bleeding. That's fine. First couple of days, drooling and bleeding will be absolutely normal. Put a towel over your pillow whenever you're laying down and you're getting ready to fall asleep, or you feel like you're going to fall asleep. Because when you sleep, you're going to drool, you'll bleed. It's going to be normal. Don't be embarrassed by it. Don't get frightened by it. It's going to be completely normal for the first 2 or 3 days. Also, a good time throughout the days, for the first couple of days throughout the day, start trying to talk with these things in your mouth, and try to get your mouth used to having the dentures in there, and getting used to having the big foreign objects inside your mouth. So try to talk, try to work on your speech, because your speech will sound like you have a lisp, if even as good as that, for the first couple days. The first day or two, you may just want to not talk at all. I know that I got frustrated when I was trying to talk the first couple days. I got frustrated, and it was not cool, because I got frustrated because I'm sitting there and I'm trying to talk to people, and I'm trying to talk, and I can barely, you can't talk, and I got so frustrated. But don't get frustrated, because it's normal. The best thing you could probably do is, like I said, grab a book, even grab a child's book. I grabbed a Grover Goes to School book. It was an old Sesame Street book. Grover Goes to First Day of School. And I was reading that out loud. And I was reading it out loud to myself, trying to make sure that I had my S's down and my F's down. It's going to sound weird, but you need to get used to talking with the dentures in your mouth like that. Got to get used to it. So reading out loud like that and trying to really enunciate and get everything right that way is going to be very good for you in the long run, especially in the first couple days. Your best friend during these couple of days, 2-3 days, up to a week, is going to be the Ensure shakes, protein shakes, the Boost. You can also try, like, soup, like chicken noodle soup, or just like regular soup in general, you can try scrambled eggs at this point. Scrambled eggs didn't work out for me the first couple of days. I made that mistake. It didn't work for me. So, but Boost for sure is going to be your best friend, and sure, shakes are going to be your best friend. It's going to give you the vitamins and everything that you can through a drink that you don't have to chew. So make sure you stock up on a bunch of Ensure and a bunch of that Boost and the protein stuff, because that's what you're going to be living off of for the next few days. Do not get frustrated at this point. If you get to day 3, day 4, day 5, even up to a week, and you still find out you can't really eat anything, do not get frustrated. If you think you're going to be eating steaks within the first week, you're going to be wrong. And do not get frustrated. Do not get frustrated. Don't expect that you're going to be eating steaks and corn on the cob and you're biting into apples after the first week. It's not going to happen. So I want to say after the first week or so, okay, so you're done taking your antibiotics, you're done taking whatever prescriptions that they give you. Now it's time to go back to work. Now after about a week, you should be able to start eating some kind of semi-solids. You should be able to easily eat like soup, chicken noodle soup. I know that when I went back to work after a week, my best friend for lunch every day was SpaghettiOs. And not even the ones with meatballs in them, just regular plain old SpaghettiOs. Because even the meatballs at this time were difficult to chew. Don't try to strain yourself trying to eat something that you can't. Your body will tell you if you can or can't eat, and it will tell you very quickly. Do not get frustrated with that. I promise you, do not get frustrated. It's going to be the best thing in the world for you in the long run. But after that first week, you may notice, you're starting to eat like SpaghettiOs. You could probably have scrambled eggs and stuff like that. And you might also start noticing that your dentures kind of fit crooked or they're loose. If you have bottoms, your bottoms get clipped in. You might find that your bottoms just pull right out, and like one bad sneeze will send them flying across the room. This is normal. Do not call up your dentist saying how much of a loser he is at life and how much he sucks at his job, and thinking that you got robbed for a whole bunch of money for an oral procedure that wasn't even done right. This is completely normal. Your mouth is healing, and it takes up to 6 months for your mouth to heal completely. So what happens is that even after the first week, you may notice that your dentures don't fit right. What's going to happen is that you're going to need soft relines, because your gums are so swollen after surgery. It takes a little while for them to shrink back down to a normal size and get them back to where they're going to be. Call you back in for an appointment. They'll do the whole thing with your impressions again. It's going to be a little easier this time because you don't have any teeth in there, or at least the bad ones are gone, so it's not going to hurt. And they're going to do the impressions once again, and what they're going to do is actually fill your temporary denture with a soft compound, a kind of a soft supportive compound. The best way that I can describe it is that your mouth is going to feel like a Tempur-Pedic pillow, and your dentures are going to fit beautifully. They're going to be nice and tight, and you're going to feel so good about it. Depending on the plan that you have, or whatever the case may be, I don't know, different plans, different things, whatever the case is. But I believe soft relines are pretty much covered for the first 6 months. It doesn't matter how many times you go in. You can get a soft reline done, and 2 weeks later, you need another soft reline done. So what? Get another soft reline done. But that's going to give you a little more confidence. And at that point, you may start even noticing that you could start eating a little bit more after you had the soft relines done, because if your dentures are loose fitting and they're shifting around in your mouth and they don't feel comfortable and all that stuff, it's not going to feel comfortable biting down on stuff. So, and not only that, but with the soft relines, you may notice before you get your soft relines done that if you do eat something, like you're eating scrambled eggs, you notice that a lot of times that your food will probably get stuck up under the bottoms or maybe even up top. And the soft relines will help with that. Getting food stuck in your dentures, especially early on, super common. Do not be embarrassed by it at all. Even as somebody who's had dentures for a long time, like my mother's had dentures for a long time, it still happens to her. Getting food stuck up in your dentures is gonna be normal. It'll be 100% normal. So now after a couple weeks to up to a month, you're gonna be doing this soft reline stuff, but you'll notice that your mouth is gonna start feeling better. And what's gonna happen is that after a month or so, you're gonna start noticing that you're gonna start eating a little bit harder stuff. You're gonna be sitting there, you could probably end up having like like some soft beef or something like that, something that's nice and chewable. Sandwiches, eat bread, like a thin sandwich, you know, like a thin ham and cheese sandwich. You're gonna be able to eat some of this harder stuff again, and you're gonna start feeling really damn good about yourself. And now is where it's gonna start coming in, like you're really made the best decision. It's really gonna start sinking in at this point. And this will continue to get better and better and better up to the 6-month point. And at this point, your gums, for the most part, are done healing. They are done healing at this point. They may still shrink just a little bit at that point, but for the most part, they are going to be set in stone for what they're going to be. You're going to get called back for impressions again, and they're going to put your permanent dentures in. And this is going to be the permanent dentures that they're not permanent for life, but what it is that they call them permanents because you won't have to worry about them for about 5 to 7 years, and that's the recommended interval, is about 5 to 7 years before you have relines done or you get new ones. After 6 months, after you've put up with all this, you're gonna be almost eating almost at this point. I would say after at least 2 months, you're gonna be eating almost normally again. You're going to be eating almost normally. It took me about 2 months to be able to eat normally again. And they're going to give you your permanent ones, and your permanent ones are going to feel great. And at that point, you're going to feel so great about yourself, I assure you. So, to sum up, you have nothing to worry about. Understand that it's going to be a little bit of a challenge. It's going to be a change. You need to get used to it. Sometimes it might be difficult. You feel like you're not making any progress whatsoever. Do not get frustrated. It is gonna be so worth it in the long run. It's gonna be so worth it. Do not worry about it because you're making the best decision that you can make. You're gonna have difficulty talking the first couple of days. You're gonna have to get used to the feeling of having dentures in your mouth. After a while, you get used to it and they'll feel like natural teeth. You're not going to have pain, especially if your teeth are already bad. My teeth were so bad to the point that they were hurting, but they had hurt for so long that my body had gotten accustomed to it. And then as soon as the teeth were out, you feel the difference and you realize how much pain you're in every day, and your body's just kind of hiding it. You're making an awesome decision. It is going to be so worth it. Do not ever question it. It's going to be worth it. It's the best feeling in the world to be able to eat without pain, or to be able to smile without feeling self-conscious. It's going to be the best feeling in the world. It is going to pay off in the long run. I hope this video helps you out. I really do hope it helps you out. I genuinely want to help people out with this because, trust me, fearing the dentist, fearing any kind of oral work is a common feeling. Trust me, I know this. You're going to be just fine. If you have any questions, if there was something that I didn't come across in this video, feel free to ask it. I will definitely answer it for you. I'm here to help you out. Thank you for watching my video, and I hope all goes well with you, and I hope you guys enjoy your journey. You're making the best decision that you could possibly make for yourself by doing this, with getting dentures put in. So thank you for watching.